Sociocultural aspects of injury and injury response. Sociocultural aspects of sport. The sociocultural aspects of sport and sport injury and recovery include the broad landscape of social beliefs, climates, processes, cultures, institutions, and societies that surround the full chronological spectrum of sport injury outcomes, ranging from risk through to rehabilitation and retirement. Social and cultural climates, contexts, and structures surround sports and drive the way individuals act and relate to one another within a sport environment. Many elements of sport injury are affected by these social cultural influences, such as the risk of injuries, the rehabilitation process, and possible career termination. Continuing debates and discussion include advocacy for sports rule changes, bans on dangerous sport, institutional responsibility, and global sport safety efforts. Oftentimes, athletes will push the limits during participation. However, the push the limits mentality may be contradictory to healing that follows sports injury. Special consideration is given towards high-intensity sport, which elite athletes train in, and performance efforts are characterized by explosive physical speed and strength, mental fortitude to push physical limits, and maximize effort and commitment to highly challenging goals associated with achieving exceptional performance. Sports injury occurrence in high-intensity sport is an adverse and stressful health event associated with a complex multitude of risks, consequences, and outcomes. Influences to sociocultural and injury in sport include the sport injury risk, how athletes respond to and recover from injury, and how athletes determine when they're ready to return to participation. Outcomes related to athlete health and performance excellence are of equal importance in considering how psychological scholarship, expertise, and service can be used to improve efforts focusing on the prevention and management of sport injury among high-intensity athletes. The consensus view is that psychology and sociocultural do affect sport injury risk, response, and recovery in high-intensity athletes, and that continued efforts in psychological research and professional practice are needed to protect athlete physical and mental health and contribute toward performance excellence and career longevity. Here's a critical thinking concept. Try to identify a sport. See if you can define the culture of that sport. Define the structure of the sport. What does it look like? How many players are on the field? How many players are on the team? Is there an attitude of the sport or some behavioral norms for that sport? And see if you could potentially identify a couple of slogans that are typical for that specific sport. This will help us to start thinking about the sociocultural aspects of sport and sport performance. Sport injury risk. Physical risk factors. Athletes who are out of shape or lack appropriate strength or flexibility may be at an increased risk of injury. Additionally, age or skeletal maturity can increase risk factors. Prior injuries may make an athlete more susceptible to re-injury. Training patterns that are excessive or lack variety may result in overuse injuries, and most of these factors are not modifiable. Environmental risk factors may include the location of the field or playing surface, walls, fences, or benches surrounding the playing field, improperly padded goalposts, old or improperly fitted equipment, weather conditions such as rain, ice, or even lightning, uneven playing surfaces, and many of these factors are modifiable with planning, finances, and diligent observation. Psychological risk factors may include an athlete's mood state. High levels of stress can increase risk factors. Higher levels of stress result in increased levels of muscle tension, which then results in a decrease in flexibility, and subsequently we see altered biomechanics. These changing mechanics can contribute to overuse injuries. Sometimes an athlete will suffer from what is called tunnel vision, and they fail to see any hazards that are coming in their way. A lack of coping resources can occur. Goal orientations, beliefs, and attitudes can affect the amount of stress an individual is experiencing. Sociocultural risk factors. Coaches can affect injury risk through their level of experience, expertise, and the style of play they endorse. Heat-related injuries and illness are common. Failure to correct improper techniques can result in injury, as can aggressive style of play. Words or phrases that perpetuate the culture of risk in sport. Coaches may knowingly or unknowingly send that message that athletes should not report injuries. Different sports, by their very nature, have varying levels of injury risk. We have some sports that are considered contact or collision sports that will have higher risks than other sports. Officials who allow play to become excessively physical can increase the risk of sports injury as well. When medical personnel are not present at events, medical decisions are often left to untrained individuals, which can greatly enhance the risk for further injury once an injury occurs. Athletes who unconditionally buy into the slogans, all of which are sport norms, place themselves at higher risk for injury. So let's talk real quick about sports coverage. Despite the National Athletic Trainers Association's efforts, athletic trainers cannot cover all sports, practices, or events in most situations. If athletic trainers are not around, who's left to treat these injuries when they occur? Is that our untrained coaches? What about the strength and conditioning staff? What's their training? What about parents or even teammates? What's the interest of all parties involved? Think about a coach. What's their ultimate goal? Is it the health and safety of that athlete, or is their goal to win? I'm not saying that coaches or parents are bad, but we just have to understand their motivation. Let's take a quick look at the NFL bounty system. If you can click on this link, it's a quick read. Once you've read this article, think about your reaction. As a future athletic trainer, what's our role in this type of scenario? How are medical decisions made? And if we know about something like this, is it ethical for us not to say anything? Additionally, who supervises athletic trainers? If my boss is my coach or the athletic director, does that impact our overall decision? What is the role of the athletic trainer in today's win-at-all-costs mentality in many high-level sports? Sports norms. It's always worth keeping in mind that sports constitutes a social realm of immense normative complexity. There are always at least 3 levels of norms, rules, or expectations at play in sport. For one, the game itself is governed mostly by explicit rules and penalties. It also contains numerous implicit rules and expectations. For example, in soccer, kicking the ball out of bounds when an opponent player is seriously injured is common. At a secondary level, sports spectatorship is infused with various normative presumptions, be it expectations of success, fair play, transparency by a club or organization, or other expectations. And finally, a third level of normity governs or doesn't govern the undertakings of larger sports organizations. For example, the International Olympic Committee, the NCAA, or even FIFA in soccer. Several questions are central to understanding the socialization into sport. How exactly are young people socialized to become involved in sport and then stay involved in them? What standards, beliefs, or models are considered to be normal in the sports setting? Athletes are often told to be dedicated, set goals, and persevere until those goals are reached. Diversity is often accepted, and sacrifices are frequently expected. But how does this impact the injury response and recovery process? Additionally, we need to consider why some people continue to participate in activity throughout their lives, while others are just content to watch or burn out. Different questions arise when one asks how people are changed as a result of their socialization into sports. Why do some people find their primary identity as an athlete? And what happens when injury, age, or loss of motivation brings their athletic career to an end? More generally, what impact do sports have on an individual's character, relationships, thoughts, and even feelings? The sport ethics is society's criteria for what it takes to be identified as an athlete in sports today. Athletes are expected to engage in four types of normative behavior. These behaviors include making sacrifices for the game. Sports should be a top priority in their life, striving for distinction, accepting obstacles in the pursuit of success, and accepting risks and playing through pain. I would encourage you to pause this video and click on this link to see Carrie Strug. When you think about ethics and the normalization of sports, after watching the video, what are some of the ethical issues that are present in this case? Think about if you were the athletic trainer. Would you have allowed her to continue to compete? What are potentially the long-term consequences of Carrie's continued participation and injury from this activity? Sport ethic and athlete behaviors. The degree to which individuals accept the norms of sport ethic and internalize them varies greatly. Acceptance can be viewed as a continuum of behaviors. The continuum can be divided into three regions of behavior. These include underconformity behaviors, normal behaviors, and overconformity behaviors. Underconformity behaviors occur when someone is unable to identify normal pain associated with physical activity. They may over-report pain to the medical staff, and often these individuals are said to be malingering. Normal behaviors, the individual understands good versus bad pain. They report pain appropriately and they adhere to the advice from medical practitioners. Then we have what is called an overconformity behavior. These individuals throw out concern for long-term health consequences for short-term gain. They disregard or ignore medical advice to rest for healing. They may hide or not report injuries to medical staff so that they can continue playing. Athletes are tempted to engage in overconformity behaviors for a number of reasons. Some of those reasons may include a love of the game, a sense of time urgency, pressure from others, particularly parents and coaches, or fears such as losing playing positions or playing time, or being labeled weak by teammates or coaches. There may also be a sense of fraternity with the teammates, and they may also be isolated from input outside of sport. The normative behavior of high-intensity sport is increasingly reflected in some youth sport environments. The long-term consequences of this mentality is not yet fully known, but athletic trainers should be aware of potentially increased injury risks in these individuals. The professionalization of youth sports has started drifting down to younger and younger generations. There is an increased need to specialize at a super young age, which means that student athletes are now required to specialize in a sport, often as a young child. There is increased practice and competition demands at young ages. Overuse injuries are a growing concern, particularly for growing bodies, and the long-term health consequences of these injuries are not fully understood. Some gender considerations. Both male and female athletes are willing to play through pain and injury often. However, there are some gender differences. Males are more frequently concerned with the threat to masculinity if they don't play through pain, and female athletes are more likely to report inconsistencies of being athletic and being a woman. Females are traditionally more likely to be open and discuss their injuries with healthcare professionals. However, it is important that athletic trainers should avoid generalizing or stereotyping expectations about pain and injury behaviors based on gender. Some factors affecting sensible risk in playing through sport injury. We have to consider the sport that is played, also the body part that's injured. What is the developmental level of the athlete, and the time even in the season? There are challenges to the athletic trainer in preserving the primacy of the patient. Often, as athletic trainers, we spend a great deal of time with these individuals, so we may develop strong emotional ties to our athletes or our team. Frequently, there is outside pressure, for example, from coaches, teammates, parents, or even the athlete themselves. Frequently, athletic trainers are understaffed, overworked, and underpaid, and we are trying to provide our best coverage possible to the most amount of athletes. Sometimes individuals have a desire to please coaches. There may be concerns over job security, particularly if a coach or an athletic director is your boss or supervisor and can fire you or hire you on the spot. There may also be concerns about personal reputation and what other people will think. As an athletic trainer, we may need to assess an athlete for conformity to sport ethics. Rehabilitation over adherence questionnaires can be used. Athletes can be asked to locate themselves on a continuum. Another tool is the Risk Behavior Conformity in Sport Injury tool. These two tools can be extremely helpful in our documentation of sports injury. Additionally, they're objective measures, so it makes them a little bit more effective than some of the other subjective assessments that are commonly associated with sociocultural aspects of injury and health. Interventions for overconformity behaviors. First of all, education. We need to assess pain on a pain continuum. We should be discussing long-term consequences of playing through pain and injury or not reporting injuries to our patients. We ask for peer modeling. We should be looking at a risk assessment grid to identify these individuals. We may need to include an athlete support network in the injury rehabilitation process. And we need to educate individuals on the good versus bad pain. Does it hurt or is it sore? If we can we possibly identify sources of secondary gain? We can assure athletes' motives for participation are intrinsic in nature. Some additional interventions for overconformity behaviors include communication. Clarify participation limits with coaches and athletes and make sure everyone is clear as to the expectations. Explain any rationale for any restrictions given. We want to set our goals with appreciation for time and urgency. We need to use safe benchmarks for returning an individual to play. A bullseye approach to rehabilitation can be helpful, and we can negotiate some surgical schedules. We also need to focus on decreasing media glorification of playing through injury, particularly at high levels of sport. This trickles down to our youth athletes who look up to these individuals as role models.